Mrs. Smith. My name is Bill. I'm going to be your nurse for today. I do know that I'm aware that you're going home, so I did want to give you your discharge instructions. These do contain some information that you're going to need when you do go home. But first, before you go home, I know it's cold out, so I'm going to just button up your jacket for you a little bit. I know that it's very hard for you to close your jacket on your own since you lack the dexterity and proper use of your thumbs since you're so old at this point. So I'm here to help you out. All right, there we go. Now you'll be nice and warm. All right, Mrs. Smith, can you verify your name and date of birth for me, please?
Jessica Smith, 12/29/95.
Okay, very good. Thanks for remembering that. All right, so here are your discharge instructions. These contain information for what you need to do when you go home in regard to your care. That way, everything that we did you'll be able to maintain health when you go home. It also lists some side effects for the medications that you're going to be on, so make sure to pay attention to those as well. We want to make sure that you do end up as healthy as possible after you leave here. All right, so if you would, please read those, and then after you're done reading those, you can ask me any questions you want. Oh, you want some water? Okay, I'm going to get you some water while you're reading those, so just read those for now.
I don't want one.
Oh, just hold on. Please just hold on to any questions. Just read those, and then I'll answer any questions you have, and then we'll take care of things real nice for you, Mrs. Smith. Okay? Here you go. Hello, Mrs. Smith. My name is Bill. I'm going to be your nurse for today. How are you feeling?
I'm feeling okay, thanks.
Okay, all right. I know you are going to be discharged today, so I do have some discharge instructions that I wanted to give you. I do see you have your jacket on already. Would you like me to help you button that up?
No, I'm going to button it up right now.
Okay, all right. Just offering just in case you need some assistance with that, but I see you can clearly get it on your own.
Mm-hmm.
All right, so while you're doing that, these discharge instructions explain some things you need to do once you go home, certain things you need to take care of, watch out for in regards to your treatment that was done here at the hospital. Also lists your medications and what they do and certain side effects to look out for. Before we do, I do give you this, could you just verify your name and date of birth for me, please?
Jessica Smith, 12/29/93.
Okay, thank you very much. All right, so here you go. Here are your discharge instructions. I'm going to give you some time to read those, and then afterward, if you have any questions, you can ask me.
This is great. I love it that it's on paper that I can read later on.
Yeah, so it usually
But
does help people.
Oh,
did you want some water?
No, I wanted my glasses. I need them to read.
Oh, okay. You wanted your glasses. No problem. Here you are.
Okay. Let me get them on. Okay. I'm a little slow, but surely and slowly they'll get on.
Yeah. As long as you can take care of it on your own, I'm sure that feels good.
Mm-hmm. Okay. Wow. So
All right, and I'm going to give you a couple minutes to actually just look those over on your own, and then I'll come back when you are done, and then we'll sit down and we'll be able to figure things out. If you do have any questions, I'll gladly answer them.
This is great. This is really good.
Okay, Mrs. Smith, I'll see you later. Jessica, what's your problem? I just came out of your patient's room because the IV alarm was beeping for several minutes. I go in there to shut it off, and I look up at this kid's face, and he's covered in all these red splotches. Guess what? Chickenpox. And you know what? I've never had chickenpox, but now I'm gonna have chickenpox, and I start to feel the itch already. And I'm gonna be scratching all night long. I'm not gonna be able to sleep. I'm gonna miss work tomorrow, and it's all your fault.
Bill? Bill, is it? Look, why were you there anyway?
Why I was in there? I already told you. Maybe you should listen. The IV alarm is going off. And I walk in there, and I look at the door. There's no sign for contact precautions. Give me a sec. Yep, still not there. Maybe you should have got off your fat butt and actually gotten in there and put up a sign for contact precautions. That way, I wouldn't actually be scratching the entire night.
Look, you could have just came up and got me, right?
Yeah, well, I couldn't find you. Who knows where you were?
By the way, didn't you get your vaccination?
Vaccination? When I was born, they didn't require that vaccination. So I've been working since then. No, I haven't had a vaccination. Do you think I'd be scratching if I had a vaccination?
Look, it's not my problem you're old.
Now you know, children, this is what happens when you punch your coworker.
feel pretty frustrated that Jessica didn't come and take care of her IV alarms. But I don't want to go and scream at her right away, so I should probably look into the situation and talk to her first, see how she feels about it. Maybe she was busy. I should ask her. Keep an open mind. Use some open questioning. All right, also, I want to definitely check on the status of that kid, if he had chicken pox or not, because I need to check for myself, but also for the benefit of my coworkers, because the sign for contact precautions wasn't up. And I should see why she didn't put that up either. Perhaps she needs further instruction, or perhaps something got in the way. That's another thing I'm going to have to use some questioning for, and try to keep a calm state. That way an argument doesn't ensue. Sounds like a plan. Jessica, right?
Mm-hmm.
Would it be all right if I just talk to you over here for a second?
Yeah, let's go, Phil.
All right. All right. Thanks, Jess, for coming to sit and talk with me for a few minutes. I won't take too much of your time up. I just wanted to bring up, I went into one of your patients' rooms. The IV alarm had been going off for several minutes. I'm not really sure what was going on there, but I did go in, I checked the situation, I assessed everything. It did seem to be fine, so I silenced the alarm, and I just wanted to come meet with you for a minute or so just to see if everything's going okay with you.
Mm-hmm. Yeah, I did run into a medical emergency, and that's why I was at another room, and that's why the other nurses were there too. So I was a little busy. I was going to get to that whenever I could.
Oh, okay, because I looked around, yeah, I just didn't see too many people, and I guess I didn't hear anyone called to another room. And then I did notice when I was in the room that the patient did seem to have a whole bunch of red spots in their face. Was that, is that chicken pox?
Yeah, it is chicken pox.
Because I was in there and I was touching everything in the pump, and I looked over the patient real quick, and I wasn't wearing any gloves or any contact precautions because there really wasn't a sign on the door. So that's just another thing I wanted to bring up, just because now I'm going to have to be concerned about chicken pox myself. But I didn't realize that you were at an emergency at the time.
Mm-hmm.
Is there a reason you didn't put the sign up on the door?
Yeah, well, I just got the news that he did have the chicken pox. So when I got the news, the medical emergency happened, I had to prioritize, and that came first. And so that's why I was going to put that as soon as I was done with the medical emergency, but then we met up, so.
Oh, okay. Mm-hmm. I understand now. I see that you're called away, why you were going to put that sign up. I got you. All right. Well, I mean, I hope I don't get, chicken pox from here, but I do understand that you were busy, and you know what? I'll take care of the sign right now. If you have other stuff to attend to, I'm sure you have some charting to catch up to do as far as handling the emergency. So I'll put the contact precautions sign up from there, and I'll make sure to give myself a good scrubbing and hope for the best.
Thank you so much. That's great. Great help.
All right. Sounds good. All right. See you later.